Welcome to Nursing School.
Welcome to Nursing School.
Directional terms used in anatomy and physiology. Superior and inferior, toward and away from the head, respectively. For example, the clavicle is superior to diaphragm. Anterior and posterior, toward the front and back of the body. For example, nipple is anterior to ribs. Medial, lateral, and intermediate, toward the midline, away from the midline, and between a more medial and lateral structure. For example, the upper arm is lateral to the breast. Proximal and distal, closer to and farther from the origin of the body part. For example, phalanges is distal to carpal, vice versa. Superficial and deep, toward and away from the body surface. For example, the vein is superficial compared to artery, vice versa. Axial means head, neck, and trunk. Appendicular means appendages or limbs. Before we start anatomy of body system, we are going to focus on body plane. Sagittal. We say sagittal when divides the body into right and left parts. Mid-sagittal or medial. When sagittal plane that lies on the midline frontal or coronal, it divides the body into anterior and posterior parts. Transverse or horizontal, cross-section, it divides the body into superior and inferior parts. Oblique section, it cuts made diagonally. Body cavities. We have two types of body cavity: dorsal cavity and ventral cavity. 1. Dorsal cavity protects the nervous system and is divided into two subdivisions. Cranial cavity is within the skull and encases the brain. Vertebral cavity runs within the vertebral column and encases the spinal cord too. Ventral cavity houses the internal organs, viscera, and is divided into two subdivisions, thoracic and abdominopelvic cavities. Thoracic cavity is subdivided into pleural cavities, the mediastinum, and the pericardial cavity. Pleural cavities, each houses a lung, mediastinum, contains the pericardial cavity, and surrounds the remaining thoracic organs. Pericardial cavity encloses the heart. The abdominopelvic cavity is separated from the superior thoracic cavity by the dome-shaped diaphragm. It is composed of two subdivisions. Abdominal cavity contains the stomach, intestines, spleen, liver, and other organs. Pelvic cavity lies within the pelvis and contains the bladder, reproductive organs, and rectum. Abdominopelvic regions. Umbilical is central region. Epigastric region above the umbilical. Hypogastric is region below the umbilical. Right and left iliac or inguinal is the region that are in left or in right side of hypogastric. Right and left lumbaris the region that are in left or in right side of gastric. Right and left hypochondriac is the region that are in left or in right side of hypergastric. There is 4 big abdominopelvic quadrants. 1. Right upper, RUQ, 2. Left upper, LUQ, 3. Right lower, RLQ, 4. Left lower, LLQ. Homeostasis means maintaining a fairly constant internal environment in spite of a changing external environment. All body systems attempt to maintain homeostasis. Disease is a homeostatic imbalance. Symptoms are subjective changes that are not apparent to an observer. Signs are objective changes which can be observed or measured. Thanks for following Nursing School Clinical. Remember to subscribe, share and comment on this video.